Hi, this is John Rasmussen, and I have a very special guest today, Dr. Katrina Ostmeyer, who is a licensed psychologist, board-certified behavior analyst specializing in neurodevelopmental profiles, complex behavior, and co-occurring mental health conditions. She is the founder of Beyond the Individual, where she helps families and organizations build practical, evidence-based approaches that actually work in real life, and is a professor of the practice and clinical director for the KU Child Psychology Program. She's grounded in the belief that effective care has to fit the person, the family, and the system around them. She spends her days training clinicians and providing services, and her evenings keeping up with life as a mom of two neurodivergent kids. Never one to say no to a new experience, she's built a few fun facts along the way. She plays euphonium enthusiastically, if not expertly, in a brass band with her much more talented son, holds a black belt in Taekwondo, and was part of the Guinness World Record for the largest tuba ensemble. When not running around with her kids, you'll find her happily exhausted watching Lower Decks as a family and her dog Gershwin. So welcome, Katrina. Thank you so much for coming, and I'm looking forward to this discussion. This is going to be great.
Yeah, thanks for having me.
Yeah, this is one of those subjects that I like. Anyone, virtually everyone has had experiences with this, I would say, at this point. And I can say in my own practice over several decades now, I mean, this is often a big challenge that comes up, right? Dealing with neurodivergency, not only in our kids, but we're finding out even as adults like me that we are also that, and it explains a lot. And then I see so many people just struggling with, how to manage it, what to do. I mean, there's a it says in here, and we'll let you talk about it here. There's so much advice, and you just feel like you got to do more, right? But I think maybe more is not always the key. But so tell us your experience with this. How you got interested in this particular subject of psychology, and how you're approaching it differently.
Yeah, so similar to my bio, I am a person where when opportunity knocks, I like to say yes. And I honestly fell into my career path just through a series of yeses to start. I was looking for a degree program, knew I wanted to help people for a living, and ended up in behavior analysis, learned about autism at that time. And at that period of time, our definition of autism was a little bit different than it is now 20 years later. And also working in emotional behavioral disorders in youth in a group home setting. With that, I continued to say yes. I went to grad school and had the opportunity to develop some specializations in obsessive compulsive disorder and anxiety, just because the opportunity came, and I said, okay, let's do it. And found I just really was having a hard time after my master's deciding what I wanted to do, and decided I wanted to do research for a living, and went to do my PhD. Had my own my first child in graduate school, which changes some of our plans. And I had an opportunity arise that would bring me back home to run a not-for-profit focused on providing services to children and youth in rural areas with autism. And through that experience, started to lose some of the rose-colored glasses that I had in my education, where all this works and all these systems are perfect, and if we just follow the manuals and do the right things, it will work. And started to realize very rapidly as I got into my career that's not always how things work, right? It's not perfect. Systems need to work together. There's holes. And that led me to developing my own program and clinic Beyond the Individual, because I was seeing so many families falling through the cracks in these systems, and also have my own family with neurodivergence, and knowing that we were having a hard time. And if I'm having a hard time, I've got all of this training and specialty. I can only imagine other people who don't have all of that knowledge, because there were definitely times where I, as a parent, was questioning whether I'm doing the right things. And still do, to be honest.
Well, yeah, I mean, I would imagine, like, we're human, and there's always so much more to learn, and there's new experiences. I mean, just hearing you talk about it, I was thinking back a little bit in personal experience, family experience, friends, and so on, that, how do you differentiate when somebody has like a truly, whatever, biological, neurobiological, neurodivergent situation going on versus just the challenges of today's world, which are just such a huge factor. How can you even tell that it's not just distraction or social media or this and that versus there is a real developmental issue? And at what point, would somebody notice that, either in their children or themselves or anyone?
Yeah. And this is such a great question. I think about autism specifically. Our incidence and prevalence of the disorder has just skyrocketed in the last, 20 years. And when we're looking at that, some of it is we've changed our definition of what it is. So even when we're looking at, the first thing is labeling it, is this neurodivergence or is it something else? We're using these black and white, like it is and it isn't. And I think that's the first thing that I often tell people, because I often work with what I call gray area kids. And these may be kids who, depending on who the person doing the diagnostic evaluation is, they may or may not end up with certain diagnoses or certain profiles. We also are seeing that neurodivergence, when we're labeling it, can have very different forms. And so we can see there's a lot of different brain mechanisms. Some of the current research looking into this is focusing on there's multiple pathways, and there may be kind of this family broader autism phenotype for some of these level 1 or less severe cases. And we have more genetic disorders or some different changes, right, going on there. And so even looking at the label, it's one of those things where it's a little bit of a wishy-washy concept right now for some of these things.
Sure.
And then I always look and say, like, what is going on? What are the problems? And I often start, and I work as both a diagnostician and as a therapist. And we look at what is going on with that whole person. So even with our intakes and gathering information, I ask about social media use. Like, is your child even on social media? My preference is they're not, but the reality is a lot of them are. What are their electronic consumption patterns? How do they sleep at night? What do they eat? And we do see some of these things. There is both that bio and environmental component. We really don't see very many behaviors that are just all biological, right? There's an interaction going on here that changes how they present. And when we're looking at those treatments too, we can look at both of those factors to address those concerns.
Right. So I guess that's where it gets tricky, right? Because there's limits to what people can do in a challenging world as a parent, and having to work and this and that, and who's actually influencing their child, and then where do you which one do you focus on, right? Do you try to like bend the world to manage the symptoms, or do you look for more core, with my work, for example? I mean, it gets even more complicated, right? Because, I'm going back to, kind of soul level stuff, not just genetics and epigenetics and stuff, but it's like, we all know that people will come in with entirely different personality, two children close apart come in with entirely different personalities and all this stuff. And it's like, how much of that is just inherent to their consciousness, and impacted by whatever happened previous to this life. So, you can imagine, like, we can go down a rabbit hole of there's even more factors, but, leaving that aside, it's already complicated enough as to, what factors are going to be the most effective. I'm all about pragmatism, effectiveness, efficiency, like do the thing that works, that takes the least amount of effort, like why not, right? Or get to the core of the thing, like if you can oftentimes multiple symptoms, let's say, arise from one single core issue, and if you can address it at that level, then you can save a lot of time addressing all the symptoms. Would you agree with that? Or how does maybe in a very practical sense for listeners who haven't done a lot of research, maybe don't know all the words and the the stuff that would take a PhD to really learn, and I'm that way. I like to learn everything I can about everything, but for folks who are just trying to go, what would be my first step if I suspect, or if I'm just having trouble, I'm challenged, maybe they're seeing a psychologist, maybe not, but what would you say is the most practical and effective way to start addressing what seems like a neurodivergent type issue?
Yeah. And there's it's a little bit of a nuanced answer.
Of course.
And
Yeah.
I usually start with the person. And we know that if we can help kids feel successful and come into contact with more success and positivity than they do negativity and corrections, we can actually change a lot of behavior and really set them up for success. And it also helps take away one of the questions of what's driving this and what's driving some of these symptoms. And working with neurodivergent and honestly kids who, again, neurodivergence takes many forms. Maybe it's anxiety or, ADHD, autism, etc. Maybe it's just, I sat on YouTube for 4 hours and I'm dysregulated, But I think about how can we increase more positivity and positive interactions. And when we're looking at the core of all of our interventions that are effective from a parent and environmental standpoint, we start with how can we see the good things and focus on those first. And so if I were to work with a family, that's one of the first things we do is like, how do we increase the positivity in this child's life and interactions?
I love that, because it speaks to the notion that we're inherently our species is unique in its adaptability, I would say, right? So, you can have inherent challenges, and maybe they're not fixable. Like you can't, but make the best of it, or focus on what's good, focus on what works. Like I really appreciate that, because I think it's that notion of just being like a high functioning whatever the challenge is, right? And is that what you're saying, is that if we can make the person feel successful, good, capable, even with the challenges they have, right?
Mm-hmm.
Then you don't have, then it's like, well, they're kind of in the background then. Like they're not the major issue. Is that fair to say?
That's very fair. And I even have, I had just a conversation with my daughter yesterday because we were having a rough morning. Transitions are hard for us. And I was asking a lot of questions, and she said, Mom, stop. I think she said, stop grilling me. She's like, I don't know what was wrong. And I was like, well, we got to figure it out. But sometimes we get so focused on the problem that becomes who they are, and it's like that's what you care about, is that I have this problem. And it's like, oh my gosh, I realized I just like made the number one fallacy or
Right.
problem that I see for families is as a parent. I was like sitting here focusing on her problems instead of her
Well,
many, many strengths.
that speaks to so many things because I have this same challenge. I have to know, well, I have to work really hard, let's say, at the difference when I'm advising a client, in an hour-long session. And my whole job at that point is to analyze, is to ask questions, is to come up with new framing, new perspectives, a new way of thinking or doing things. And then when I'm not in that, I can't do that to my family. Like they're not asking number one. So that's a huge, it's true for teachers, it's true for mothers whose kids grow up and then they're still treating everybody like as a mother, you
Uh-huh.
know. That's it's really hard to turn on and off, right? Like,
Hmm.
and like you said, it's not always the time to be solving or trying to fix or improve a situation. Sometimes it's just living, like differentiating a psychology session with just life.
Yes, absolutely. And I didn't think about, what's the next thing. So I understanding it and being able to label it or say, here's the reason this is happening, can be helpful to a point. And I I'm trained as a scientist, and I go back to my scientific training too with that and really focus on, okay, well, we have a hypothesis. I'll never know for sure what's going on under here, but I can test that hypothesis. And if I can do some simple things and try to do them the same way most of the time, I can test whether that hypothesis is accurate or not. And so that's kind of the other thing that I tell families is like, let's start first with just being positive, right? And focusing on the good things because we learn through building skills and focusing on the good things, not by punishment or deterring. And then it's like, okay, it's not going to work right away. Everything that I do, how do I stick with it and work through the hard things so I can test my hypothesis, see if what I think is going on is correct?
So what would be an example of that? How for somebody, I don't know if we can think of a good example of, I know being positive, like you said. Is there another example you could think of that someone like a lay person, if you will, could try that with?
Yeah. So when we're looking at some of the difficulties that can come with neurodivergent profiles or even just behavioral profiles in general, we want to first say, yes, we want to have a hypothesis or a guess of why is that behavior happening. So because I really can't talk about my clients, I often will come back to my own life
Sure.
or
Yeah,
my
right.
kids.
I do
Yeah.
the same thing. Yeah.
And both of my kids have ADHD and anxiety. And so when something is going to take a lot of time and effort, and there's also a chance that it can be wrong or inaccurate, they're likely to try to avoid those situations to some degree um, because it feels uncomfortable to go do something that I might not be immediately successful at and to spend a lot of work at it. And so, what we kind of focus on when I'm saying being consistent, I was like, okay, my hypothesis, right? Or I think you're trying to not do this hard thing, not because you're insufficient or lazy or anything. It's because it's hard and it's uncomfortable. And so, we try to be consistent in how we encourage our kids to face those challenges. And we look for challenges and we talk about what are some things that were hard and what are the things we want to lean into that are uncomfortable today. And so we consistently work with our kids, sometimes more successfully than others, to say, like, what's the thing that you're going to do that's hard for you today? And how are you going to face that? And how can we help you do that? And we try to do that every day because that practice is going to be really important for them.
Yeah, I think that's great, and it reminds me also, and this is also something I work on personally, is sort of patience, right? Is knowing that this isn't something that you do a thing and then boom, the kid gets it, they're good to go, they're no longer, they can go they can go stand and talk in front of a crowd and they're not anxious or whatever. Like, I always have to remember again this adaptability thing that when you're talking about children particularly, right up until what the fully developed brain in the mid 20s even, and I remember that I remember what a mess I was in my 20s, having to get up and give a presentation, and I'd be shaking and nervous, and eventually I think a lot of these challenges begin to mitigate a little just through the process of maturing, right? Like
Hmm.
they'll be fine. Like my thing when I'm working with a child that I really care about, like in my own family, is it's uncomfortable for me to see them struggle or to be uncomfortable. So I want to fix it right away, and I have to be reminded that they'll be fine. Like I don't have to fix it today or even this year or even next year for them to be, because I always think, well, how's this going to affect them when they're adults? Like, oh no, like when they're 20, this is going to be a huge problem. Like if they don't fix this now, this will be a big problem. And I had a personal experience like that when I was 14. A roommate of my brother's in college was getting his PhD in psychology, his master's and then PhD, and he chose me as his subject to do analysis on. And the sort of final conclusion that I got to read when I was 17 or so, right before I was going to college, was something to the effect of, if I don't stop like living this Spartan existence, I was all about like high performance, like do everything 100% and da 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 da. And he goes, if I don't open up a little bit to emotions, I'm going to end up being like a sociopath later in life. And I'm like, oh, okay, I better work on that. So I sort of allowed myself to like open up, which was messy, but it was really kind of awesome advice, because eventually, I think he would have been right, and it was kind of nice to get a little bit more well-rounded, let's say. But it's the same. It's so I think, oh, that's a unique experience. Not everybody gets a PhD done on their life, um, but I try to translate that and I go, well, if I just tell them just the right thing now, it'll save them when they're an adult. But I think that's not like that's more my problem than theirs, right? Would you say,
Yeah.
like, what do you
I
think about time and patience?
I think you said two things that I actually resonate with me. I actually say them frequently in my own work, and one of the things I often tell parents is maturation is a beautiful thing. And I almost any client who sees me has heard me say that about kids, because the reality is no one's perfect. Kids are going to have behavior. And there's some things that the brain just needs to mature. Like if I have a kid who has emotion regulation difficulty, I'm going to teach those skills, and we may plateau for a period of time. So we're going to get to a point where we're going to like, this is how far I can grow right now. But then we hit these certain periods of development where the brain just changes rapidly, and all of a sudden I'll see this skill they just made a huge leap in like a few weeks, when we've been kind of at the same place and managing it for a year or two. And so we really focus on what am I going to manage versus, and let maturation do its job. And what are the things that I'm going to make better? And sometimes success is not, oh, I've got rid of that symptom, or my kid
Right.
is behaving super well. Sometimes it is, wow, you know what? Our outbursts are shorter. My house isn't destroyed, Yeah, we still have them and they happen on a daily basis, but I feel like I can manage it. And so I think that's one of the things is the goal needs to be realistic for where we are and how our brain is working right now.
Yeah.
I think
I
the
love,
other thing you said too is,
yeah.
am I doing this? Is this my problem? or my child's problem or a child's problem.
Right.
And that's another thing that I often will say. It's, what are our motivations in managing behavior? Is it, I want things to be better for my child. I want to see life be better for them. Usually it's a combination. Like when people come to me, it's, I want life better for my child, but also like I want it better for the rest of us too, because this is hard and it's okay that it's hard. But then there's other times where I was like, well, we're going to work through this. Like, we're going to let that behavior happen. And you know what? Maybe it's going to happen in the grocery store. And how are you feeling right now? You feel pretty uncomfortable because it's embarrassing. And there's people who are walking by making snide comments. People are staring at you. You're like, oh my gosh, is someone going to call Child Protective Services when I let my kid have this meltdown on the floor? And that's a really uncomfortable situation to have to work through some of these behaviors sometimes. And we have to choose to do that. So we choose to let go of control and be uncomfortable because at the end of the day, sometimes that's the best thing for our kids too.
Yeah, that's fascinating. I mean, I'm sure plenty of people. I know I've been in that situation, right? And all those thoughts. Oh my God, what if they think I'm, this or that? I noticed something you had mentioned, and I want to kind of touch on it a little bit more, and that is like what to do when interventions fail, right? What do you do when things work really good in therapy and then it happens on the outside world?
Yeah.
How do you deal with that?
Yeah. And this is one of my favorite things to talk about. I'm going to be honest. So if I start getting a little too
No,
nerdy
you
out,
go. You
you
go.
just
This is
bring me in.
this is very helpful
Um,
stuff.
So the first thing is, we're actually a lot of our clients that come to us have done a lot of therapies. They're like, oh my gosh, I did all the evidence-based things. They said I did, parent-child interaction therapy, which works for a lot of families, right? And they're like, we got to a point we didn't get better or things like that. And so there's a few things that I start with parents and really start with, we really want to, first of all, shift blame away from families or some and the providers, or it's not like the provider didn't do their job or parents didn't do their job or the kids deficit. It's we need to make sure that the system fits. We need to make sure that the intervention fits and the things that we do in an office can come home. And so that's one of the things a lot of people find is they're like, my kid, we do these sessions, we're getting the coaching and everything's going great. And then I try to do it at home and it's not the same. And we know that what's happening around us changes behavior. And so when I go home, when I'm in a therapy session, it's me and my kid, or maybe both parents and a kid. But then I go home, I've got two other kids and a dog and a job and all these other things going on. And during that therapy session, the TV's not available, the tablet's not available, but at home it is. So that's a fight I haven't had to learn how to fight. And so one of the things that I, first of all, tell people is like, we need to think about what is making it work in that therapy environment and how do we bring it home. And so that doesn't mean quit your job and get rid of your other kids, right? That's not a rational choice. But it may be we need to shift our intervention so we're doing the same thing in a different way. So I think about like giving attention and building we call it building rapport, or building that relationship is the first step in parent-child interventions. And so a lot of therapy protocols focus on something called special time, where you spend one-on-one time with your kid for 5 to 15 minutes a day, and it can be really impactful. And some families, that's not the best way to do it. Maybe your child needs a little bit more attention sprinkled throughout the day. And the issue isn't that you're not giving them enough attention, it's how they're getting it and when they're getting it. We can see that maybe my child only has this problem behavior, not when I'm not giving them attention, it's when somebody else has my attention. So, we have the new baby brother, and baby brother is getting all the attention, and I'm like, whoa, hey, what's going on? And so one thing we want to look at is how can we build that into our therapy? environments as well, what we're going to see at home. The other cool thing is, we have all these cool technologies where we can bring therapy into the home, right? So, telehealth is a beautiful thing. We do coaching. We can kind of hide and pretend like we're not there so we don't have that same reactivity. Kids often behave better when other people are around.
I was going to say the one thing I was going to ask about, because I've seen this, are the kids that are clever enough to know how to say all the right things to the therapist, to like win the game, to get a high score. Like, I'm totally cool. And then, right? That's so challenging.
Yeah, and there's ways that we can be more covert, right? Or hide with the telehealth, or for some of the interventions we do, for some of the profiles we see are a little bit more intensive, so many hours a week for some of our clients. When you're in someone's home that many hours a week, the kids get used to you and you get to see everything too.
Right. Totally right. It's a whole different story. You spend a lot of time with the kid. The other thing I wanted to ask you before I forget as well is, like, and you were starting to touch on it here with like telehealth, but what for maybe people who can't find a good therapist, or really can't, can't fit that in somehow, resource wise or time wise or whatever, good resources online or apps or anything like that can be helpful, or games, like, are there good things that you can kind of sneak this in, if you know what I mean, without, or even have the kid doing it themselves and not even realize it's therapeutic?
Yeah, and so some of it does depend a little bit on what's underlying, right? So is this just like, hey, it's just a parenting thing, right? And we don't have any kind of like ADHD or anxiety or things like that, or maybe it's just those normal everyday stressors like new kids, a new pet, starting school, that people work through, but they still are stressors and stressful. I will often recommend just kind of basic parenting books and apps. There's some really cool things that are coming up. What I do tell people is, please don't use ChatGPT. That is not a good therapist.
Don't use
So stay away from chat. Claude, AI is not a good therapist. But it's really focusing on and reading through books and apps that have three components. And that is there a piece that has a relationship building piece to this? So if there's not a relationship building piece, you're missing 50% of the equation, right? We have to have connection to have, for these things to work. The second piece is, are we focused on building skills, right? On dealing with things. So even, starting school is stressful. I have a kid who's anxious and worried about it. Well, I need to build the skills to manage my worry. The goal's
It's
not
like a muscle, right?
Yeah,
You really do have to exercise it, if you will.
Yeah, you do. And things like self-control. And I always say life is uncomfortable, and the people who seem to be the most successful, and when I say success, I'm not just talking like best jobs, most money. It's those
Mental
who are
health-wise.
mental health, happy with their lives, are people
Right.
who choose to be uncomfortable when it's worth it. And so that's a muscle too, being able to be uncomfortable.
So
And
being comfortable with the discomfort, basically.
Yep. And that is a key piece of pretty much any therapy program as well. So it's skill building. We're focusing on those things to help kids build the skills they need to be successful in the environments they choose. And then the last piece for like parenting is some guidance on what to do when problem behaviors occur, because they will. And there's a lot of ways you can manage problem behavior, and some of them are there's a lot of correct ways. There's also some things that we don't want to do, and those don't usually end up in apps and books, is the good news for the most part.
Hey,
No, because we don't want to, corporal punishment or things like that. Yeah. But there are some things like, how do we manage that situation when everyone's a little bit heightened, and neurodivergent kids usually have neurodivergent parents, and
So
it's how do we help everybody stay calm? Maybe that is simple as, we're going to separate and we're going to put in a plan for what we're going to do when problem behavior occurs, because then we can be more logical and thoughtful in how we approach discipline, instead of reactive and emotional. because when we're reactive and emotional, that's where we tend to have breaks in our relationship and do things that are ineffective.
Right.
So
So
I look
this
for
is
like
muscle building as well. This is like
it
muscle
is.
building for the parent, for everyone involved. You've
Yes.
got to practice these things.
Hmm. Very accurate.
So interesting. Have you ever looked into how, let's say, like indigenous cultures or primitive, like still somewhat primitive cultures manage this? And is there neurodivergence in those cultures to the degree that there is in ours? I'm just curious, like, right, because they don't have necessarily the technologies and the PhDs in research and in these studies, but
Hmm.
I'm curious if there's any that are really effective at it
Hmm.
that people have looked
Yeah, and when we're looking at, are these conditions more or less prevalent in other cultures? I will say the U.S. has some of the higher incidence and prevalence rates of mental health concerns, and like European countries and such. We do see differences, in more like Eastern philosophy or more indigenous cultures where these things might be a little bit lower. Now, the question is, are they lower because we're not diagnosing them and labeling them? Or is there an environmental effect as well? And, I think about kind of like collectivist versus more individualistic cultures like we have it here in the US. I will say I love and I find it really fascinating for some cultures, and I think about some of our indigenous peoples here in the U.S., even in Alaska, some really cool ways of that are really effective parenting practices that fall culturally into what we're trying to do and teach people. And one of the things that I remember reading is like for a lot of these cultures, like reacting in anger is like that's a very childish thing to do, and they teach patience and essentially value emotion regulation and cooperation and patience with their children. And when you have patience, the behavior can work its way out. It's when we're trying to control it sometimes that we can throw gasoline on the fire, so to say.
Well, we live in a faster paced society,
Yeah.
right? We don't like I've got to get to work in 10 minutes. I've only got like this has got to stop now. Otherwise it's
Yep.
fascinating, isn't it?
Yeah. And it's funny too, because I even see that for myself, we had a period of time where we were really struggling with getting to school with my youngest, and I I get anxious about time. I do not like to be late. Never have. I have a sister who has the opposite problem, but it would cause me anxiety then too. And I would realized as my child was having more difficulty, I was getting anxious and agitated and showing that as well and throwing gasoline on the fire.
Right.
you know? Um, and
Definitely.
so I'm very fortunate. Not everybody can do this, but I was able to rearrange my schedule. So I gave myself an hour buffer. And so I did not have to be rushing to work, and it would give me the opportunity to work through that behavior. And we had some additional supports and things to help along with the way with that. But I'm not saying that our mornings are perfect, but it allowed us the opportunity to I don't think if I had not made that change, I don't know that we would be successful.
Yeah. It comes back to this like no blaming thing. I realize I'm kind of piecing this together in terms of two things. One, the time issue. There's a anecdote from my indigenous Peruvian Caro tribe that I've studied my shamanism with, and one of the anecdotes is they say, you Westerners, you own your land, you own stuff, but time owns you. Got to get there on time, or you lose your job. You got to get there on time, or some. And they go, we are stewards of the land. The land owns us, but we own time. Synchronicity. If I'm late, they'll be late. So no big deal. It all works out. It's this flip that allows them, eminently to be patient, right? Like they don't have the issue because they're not owned by time. Our whole society is. So I think I bring this up because it's like, man, we're already handicapped. We're already challenged just functioning as humans, period, relative to some of these more isolated indigenous cultures, with being able to do all this stuff you're talking about, like just being able to stop in the moment and like shift your perspective, or calm down, or go, oh, well, I've got to rearrange my schedule to do the right thing for my child. I mean, and so I think I don't know, I'm making this statement, that maybe for the listeners, and that, I think if people can recognize that we're already living in sort of an unnatural world, society that we've created over probably a couple thousand years, if not longer, that it's not all on you. You know what I mean? Like, this isn't anything you necessarily did wrong. Gosh, not to mention, without, I try to avoid controversy if I can, but, like when you said environmental, right, you go, well, a lot of people think, it's vaccines, right, caused all this. I don't tend to think that so much. But I do suspect, and maybe this is my own like conspiratorial controversy, but it's like that things like glyphosate, let's say, these neurotoxin type things that are meant to kill bugs, that we started using like at a date and time that literally was when a lot of this stuff started to ramp. And I know how it affects me personally when I'm around it. It really messes me up when someone's been spraying it. And so it just makes you wonder, in addition to our society, some of these like actual chemical based environmental things that we eat, we consume, that stuff's everywhere. For example, doesn't also have an impact. And it's the problem with saying something like this and delving and dipping my toe into this controversial stuff is that, like, what are you gonna, like, what can you really do about it, right? Like, pretty much nothing. Like, there's not, like, we're not all gonna move out into the woods in some isolated place. They're now spraying glyphosate in forests, like, to stop, in California, to stop, it's like, oh my God, like, you can't even live out in the woods. What do you think about that? Like, I don't want to put you on the spot and have you go to the controversial place, but it's
Yeah.
like,
Well, I think one thing that you said that's really important is like there's some of it we can control and some of it we can't, right?
yeah,
So the reality is, for me, I'm a very privileged person. I can choose where I resource my food. I can choose, I have a hydroponic garden, honestly, in my kitchen. But I'm a very privileged person. I can do that. Families I've worked with historically, they live out in like Western Kansas, and it's amazing how you can live in farmland and be in a food desert. And so maybe you're relying more on certain like canned foods and things like that. And I grew up in Western Kansas most of my life, and just what we had available and how we sourced our food and everything was different. And it's one of those things where I was like, okay, what are the things we can control? I do think things like if we do have the opportunity to control some things like diet can be helpful, right? And even if I just think about, super ultra processed foods have lots of sugar, not a lot of good nutrients, or I see some kids where it's like, you know what, we need to be eating at certain times because if we're hungry, we're hangry and we're mean. And so, but what
yeah.
would be some of the things that we eat, and what are some of the things that we can avoid? So, I do come back to that there's a lot of things that are not regulated in the US that are also regulated elsewhere in the world.
Yeah.
And I think there's some data to support
Sure.
that
Yeah.
they're
I
not
know.
great for us.
No, right. right. But you know, I'll tell you what, this is interesting because it's personal again as well. That when I was growing up, I won't say the date, but suffice it to say it was mid last century, roughly. Um, Nobody knew anything like about any of this stuff, right? And I was definitely one of the. I was no doubt on an autism spectrum. It's part of being a shaman and being sensitive and all these things. Um, and my diet, I ate for breakfast, and I don't blame my parents because some of this was secretive, but um, I ate virtually a box of Apple Jacks for breakfast. At lunch, I would trade in my I wouldn't use my lunch money. I would just eat somebody's bologna sandwich that they didn't want to eat from their parents. And then on my way home, I would buy 5 Winchell's donuts with my lunch money and eat those before I got home. And then all the kids would go to the candy store at 3 o'clock. Worst, and maybe a little bit of something for dinner and then a hot fudge sundae for dessert every night. So I was living on the worst possible stuff you could possibly live on, and I suffered for it. I had massive headaches at certain parts of the day that were debilitating. I couldn't move. I had to lay on the couch. Nobody knew what was nobody knew what was going on, right? So it wasn't like anybody could do anything about it. My parents didn't know what to do. I was still doing good in school because the sugar obviously boosted my performance, I'm sure, for when I needed it. Like being on meth or something. But I think by age 14, I started bodybuilding. I wanted to be like Arnold Schwarzenegger basically. And it was part of that was diet, and it was like give up all sugar and everything. So I went on these 6 meals a day, all protein, cold turkey, everything else I was just telling you about. And it made all the difference in the world. Again, nobody studying it, nobody knew. I didn't even pay attention to why I didn't have headaches anymore or whatever. And I think I'm fine. My body, I think, which is, maybe I'm not, but my body seemed to recover. And I bring all this up because in spite of the challenges environmentally we just talked about, in spite of whether our diet's been good or not, these changes, we will adapt, our bodies will fix themselves, right? It takes time, takes patience. Yeah. But I think people need to understand they didn't ruin, I don't think my parents thought they ruined me by not paying closer attention to what I was putting in my mouth. It was challenging, but you can recover.
Yeah, and I think that's true for most things, right? It's even from a more mental health perspective. I would love to say that I've never yelled at my children. I have perfect patience and everything, but I'm human, and also had to learn patience, and it's something I have to practice to get better at every day because I'm still also making changes. And it's one of those things where that one time or those times that I don't do it right isn't going to ruin my child, right? And I can always do better tomorrow. And it doesn't mean that I don't need to go back and apologize when I make a mistake, but it's not going to, most things are not going to ruin them or be something you're unable to bounce back from.
Yeah, that's cool. How do you practice patience when you don't need to be patient? Is there a way to do that? Is there a way, because I always say this, it's if you wait till the crisis to practice meditation, it's too late. You got to do it. You got to practice when things are good to develop the muscle for when things. Am I right? So how do you do that? What's a good practice for patience?
Yeah, I think one of the things is learning to sit with being uncomfortable and still be with your thoughts, right? So making our actions more purposeful and aligned with our values instead of our reactions. So one of the things that I recommend is, taking that break instead of using our time and having to fill all of our time with something, or like, oh, I have 15 minutes in the waiting room, I'll scroll on my phone, right? It's sitting and just being sometimes. And it's something where I've actually had some of my best moments just working on being present. And that present moment mindfulness is not necessarily like an active meditation. It can be like, what's going on around me, and why is it important?
So
And
just stay a
so
little longer in the moment.
stay
Just
longer in the moment.
that's really
um,
good. Don't, and when you're angry, don't necessarily punch the thing.
yeah.
You have the taekwondo. I also studied martial arts, and so the punching bag is sometimes like a go-to um, thing. But like I've realized that if maybe it's better to not react right away, right? Just let
Yeah.
it.
And that
Just
was one of,
notice.
yeah, when I was in martial arts and actively working on my black belt and everything, that's the thing that I really pulled away, was actually more of that, the cultures where these things are developed, they focus on control and being okay with being you, and not reacting. And it's like, you have these skills, but the forms and everything are about breathing and being in the moment and feeling your body and using it more so than using it to beat somebody up, right? There is that piece too. Like, we did our kick
Well,
pat.
defense or whatever, naturally, right? But I think one of the values of it for me along those lines is and this also comes with working with animals and stuff like horses too, but it's like learning to relax more when things are spinning out of control. In other words, do the opposite. Like someone's coming at you, relax.
Mm-hmm.
Then you can react quickly enough to be effective. If you're
Mm-hmm.
tighten up, you're too slow, you're going to
Mm-hmm.
get beat up type of thing. So it's like that's kind of an interesting skill too, right? When
Yeah.
things are amping up, do the opposite. This is like if you're in the like I used to ride horses and do dressage and all this kind of stuff, and it was the same thing. If the horse starts jumping around, you just go limp, you just relax. So the horse gets the cue. Oh, if you tighten up, it's like phew, game
Everyone.
over, right? Because then it goes, whoa, there is something wrong. Okay.
Mm-hmm.
Does that work for kids?
If it's amazing how kids can definitely sense like you're getting agitated, right? And I work with kids with varying abilities. Some are less verbal than others, and it's amazing, kind of like how people can feed off of that energy, right? And if you're getting agitated, they're coming up with you, or they know that they're getting you're agitated. And I have some kids who like a show, so they're like, yeah, I can control you.
Right. God, that's just huge. It's so true. Wow. Good stuff. We have a few minutes, and I thought maybe if you'd like to, offer some concluding kind of, thoughts or suggestions or wisdom for the listeners. Again, where can they go? What can they look for? Where could they start? We'll put all your links, on this and stuff, so that people can look you up if that's okay and whatnot. But yeah, what do you and did you write a book or do you have
No,
some?
that
No,
takes a
but you
lot of
have
attention
some.
and focus.
Yeah. I know. It's anyway, yeah, but you have some resources people can
Yeah.
look at.
Yeah. So I think if I were to, say all of the things, it's number one is focus on relationship first, right? It's good things start with good relationships, and you need to have positive moments and positive interactions to build your foundation. And so without that foundation, we're not getting anywhere.
Focus on the within relationship, focus on the goods. What's
Focus
good,
on the
what's good.
good. Yep. Um, Recognize that patience is absolutely necessary, because we're not going to make changes or change behavior in the moment. We change it over time. And some of that is working through it and letting it be what it is. Um, and I think the last thing is that we don't have to control everything. You know, it's okay to let behavior happen and let things move along. And that we're probably not going to ruin our children in a single moment. And as long as we have that good foundation and relationship to build on, we likely, our kids can grow up to be successful adults.
Amazing. Thank you. I really appreciate that. I think your screen might have froze, but
I think
we're
it
okay.
did.
Can't control everything. Can't.
You
I'm
know,
uncomfortable, but it'll be okay.
we'll see if I can turn it off and on. But
Yeah, there you
no,
go. Okay. So thank you so much, Katrina, for all that wonderful wisdom. And I really appreciate you taking the time. And yeah, it seems, I think people can make it simple. It doesn't have to be like, I think people get overwhelmed. Like we started out by saying, like, there's so much information. There's so many Instagram people out there telling you to do this and do that. And it's like, I get overwhelmed. Which one should I do? But I love the three things, basically you just listed, which are at the core. Like, how do we filter out, just as a concluding thought here, what would be what advice would you give people for, like, not trying to do everything everyone suggests?
Yeah, I think really, focus on that relationship is really the biggest piece.
Yeah.
Honestly, if I could get rid of all the Pinterest parenting and everything, I think, people are going to display the best of themselves, not the worst, but everybody's messy, and that's okay. That's because that's human, right? And we want that to be
Okay
there.
that it's messy. I love
It's okay.
that. It's very shamanic. I tell people that all the time. The jungle is messy. The jungle hurts you sometimes. The jungle helps you. Like, it's not perfect. Nothing's ever 100% pleasurable and comfortable. It's messy.
It's
And that's
messy.
okay.
Yeah. And some of the best stuff comes during the uncomfortable.
Yeah. Somehow humanity's made it 300,000 years. I don't think we can mess it up so much that we can't. We're not going to keep going. I think we're going to keep going.
Yeah, I think so too.
Yeah. And we got a lot to learn from, I think, these children. I did a talk one time on autism and how, like, a lot of times the kids are just coming in showing us, like, hey, you guys got to make some changes here. We're not going to tolerate it anymore like your generation did.
Yeah. And I think there's so much value that every person brings, and what we can learn. And that's one of the things that I think about, especially with the populations that I'll often work with, is what am I learning?
Right. Pay attention.
Those people bring a lot of value to my life. And so, yeah. And I try to focus on that.
That's amazing. Yeah, I love that. Pay attention to what they're teaching you. Look at yourself, not just them. What seems like a problem might be a real lesson for you. So, for the parent or the adult. Great. Thank you again. I really appreciate it, and I hope people can look further into your work, and it's been really enlightening for me.
Well, thank you for having me.
Absolutely. All right. Take care.
You too.
Bye.